I think if we hadn't have gone to Cleveland, I probably would have died.
Our top story at 6, a Uvalde man is back home and recovering after a serious illness his doctors believe was related to vaping. The South Texas Poison Center confirms they are looking at several cases of vape-related illnesses in the San Antonio area. 6 people have died nationwide and more than 400 others have been hospitalized. Eyewitness News reporter Jaleesa Irizarry has the young man's cautionary tale you'll only see right here.
Back on his South Texas ranch.
This is in San Antonio.
It's hard for Colton Hubble and his mother to believe.
Look how skinny you are.
Just how bad things got.
My face.
Because less than 2 weeks ago.
So scary.
They weren't sure if he was going to live.
I was going downhill really fast.
Colton was an avid vapor for 2 to 3 years. His mom suggested it as a way to stop using chewing tobacco.
Just thought it was a safe alternative.
But now doctors are saying that may not be the case. Colton's story is one of hundreds over the last few weeks of young, healthy people suddenly getting sick.
I would wake up in the morning and I couldn't eat.
Colton went to University Hospital last month with a fever and some stomach issues, but in just a matter of days, his condition began to quickly deteriorate. So his family made the decision to transfer him to Cleveland Clinic for faster answers.
You're looking at your kid in a hospital bed, can't breathe, they can't figure out what's wrong with you, and it most likely was attributed to vaping.
Doctors gave Colton steroids on the way to Ohio, and in a matter of minutes, his breathing improved. He says his doctors diagnosed him with organized pneumonia caused by vaping. His doctors say it may take up to 6 months for him to fully recover.
I was hoping I wasn't going to die. Really thankful for my mom and girlfriend because they were right there next to me the whole time.
It's a journey that has taken an emotional toll on this 22-year-old and one that has left more questions than answers for he and his family.
They don't know where it comes from. They don't know exactly what it is that's causing it.
If we knew the answer to that, we could solve the problem.
Dr. Sean Varney is the director of the South Texas Poison Center and an ER doc at University Hospital. He says the hospital has seen at least 3 to 4 vape-related cases in the last few weeks, but says there are likely more.
But I can guarantee you it'll just continue to get worse before it gets better.
Which is why he and survivors like Colton have but one piece of advice for those who pick up a pen.
I know it's hard to stop. It's just not worth it. I think if we hadn't have gone to Cleveland, probably would have died.
Jaleesa Irizarry, KENS 5 Eyewitness News.
Meanwhile, an East Texas teen barely alive on a ventilator tonight. Her family believes it's because of vaping. Whitney Livingston was hospitalized after she had been having trouble breathing the last couple weeks. Her mother says she'd been vaping for 2 years, using 3 to 4 pods a week. Doctors are treating Whitney in the ICU for respiratory distress.
She had told me that she was smoking cigarettes, and I thought it was safe to smoke something else. The last conversation that I had with her might have been the last.
Right now, doctors can't say if Whitney will make a full recovery. Right now, no single device, ingredient, or additive has been linked to the vaping-related illnesses. But tonight, President Donald Trump says his administration is preparing to ban thousands of flavors used in e-cigarettes. The Health and Human Services Secretary says the Food and Drug Administration is finalizing guidelines to remove all e-cigarette flavors from the market, especially those favored by children.
Mint, menthol, fruit flavor, alcohol flavor, bubble gum. We got to stop it. We're going to have a whole generation of children addicted to nicotine, and that's just horrible. And President Trump, as the great public health leader that he is going to put a stop to it.
For now, tobacco-flavored products would be allowed to remain on store shelves, but only under FDA regulations. The American Lung Association is out with a new warning: do not use e-cigarettes. And the CDC offering these recommendations when it comes to e-cigarettes and other vaping devices. Young adults and pregnant women should never use them. In fact, Texas just banned the sale of e-cigarettes to anyone under 21. You should never buy these products off the street or black market. If you are a user, do not modify the cartridge or the pen itself. And lastly, if you are a smoker and want to quit, talk to your doctor instead of using e-cigarettes.